Namaskar, this is Dr. Aditya Jindal. I am a chest specialist practicing in Chandigarh. Today I will be talking about an advanced inhaler. This inhaler is called a Breath Actuated Inhaler, and this is available in India. This is a very good form of inhaled therapy. So this contains some preloaded doses, 120 doses, which can be used. The important thing about this inhaler is that whenever we put this in the mouth and take a breath, it gets activated on its own. It gets activated on its own. We do not need to press on any of the buttons or any of the cylinders, and we do not need to use a spacer with this inhaler. So I'll just show you how to use this inhaler. First of all, we have to understand that when we open the cap of the inhaler gets activated. The cap opens with a click, and now the inhaler is ready to use. Before use, we have to exhale, put the inhaler in our mouth, take a long deep breath inside. The inhaler will get activated on its own and release a spray of medicine. You will hear a click whenever the spray is coming out, and we need to do nothing but take a long deep breath, take the inhaler out of the mouth, and then hold the breath for 10 seconds. So I'll show you how to do it. So generally you have to hold the breath for 10 seconds. Of course, I am releasing the breath right now. And after we close the cap of the inhaler is ready for the second use. Thank you.